Hey everyone, Dr. Mike here. Let's talk about those powerful little pills we call antibiotics. They're like the superheroes of medicine, fighting off nasty bacterial infections. But just like superheroes, they have their limits. It's important to know when to call on them and when to let your body's own immune system take charge. Antibiotics are amazing at tackling bacterial infections like strep throat, urinary tract infections, and some skin infections. They work by stopping the bacteria from growing and spreading, giving your body a chance to fight back and heal. But here's the thing, antibiotics only work against bacteria. They're powerless against viruses which cause illnesses like colds, the flu, and most coughs. Think of it this way, using antibiotics against a virus is like trying to put out a fire with a water gun. It's just not the right tool for the job. Taking antibiotics when you don't need them can actually do more harm than good. It can lead to antibiotic resistance, which we'll talk about later. So, how do you know when to call on the antibiotic superheroes? That's where your doctor comes in. They're the experts at diagnosing what's making you sick and determining if antibiotics are the right course of action. Now let's talk about when antibiotics are the heroes we need. If you have a bacterial infection, your doctor might prescribe antibiotics. They'll choose the right antibiotic based on the type of infection you have and your medical history. It's super important to follow your doctor's instructions carefully when taking antibiotics. Take them exactly as prescribed, even if you start feeling better before you finish the entire course. Why? Because even if you feel better, there might still be some bacteria hanging around. Stopping antibiotics early can allow those bacteria to multiply and come back even stronger, potentially leading to a more difficult-to-treat infection. Remember, antibiotics are powerful medications, and it's important to use them responsibly. Never share your antibiotics with anyone else, even if they have similar symptoms. What works for one person might not work for another, and sharing antibiotics can contribute to antibiotic resistance. As awesome as antibiotics are, there are times when they're not the answer. Most colds, the flu, and bronchitis are caused by viruses, and antibiotics won't touch them. In these cases, the best thing you can do is rest, stay hydrated, and let your body fight off the virus on its own. Overusing antibiotics is a big problem that can lead to antibiotic resistance. When bacteria are exposed to antibiotics repeatedly, they can develop ways to survive and become resistant to the drugs. This means that the antibiotics become less effective at treating infections, making it harder to fight off illnesses. So, what can you do to help prevent antibiotic resistance? First and foremost, only take antibiotics when they're prescribed by your doctor. Don't pressure your doctor for antibiotics if they don't think you need them. And if you are prescribed antibiotics, make sure to take the entire course as directed, even if you start feeling better sooner. Remember, antibiotics are valuable tools in the fight against bacterial infections, but it's crucial to use them wisely. By understanding when antibiotics are necessary and when they're not, we can all do our part to preserve their effectiveness for generations to come. If you're ever unsure about whether or not you need antibiotics, don't hesitate to reach out to your doctor. They're your best resource for information and guidance on staying healthy. And if you're looking for a convenient and affordable way to connect with a healthcare professional, check out MyHomeDoc Telehealth. You can schedule a virtual appointment with a board-certified doctor from the comfort of your own home. Thanks for watching, everyone. Don't forget to like this video and subscribe to my channel for more health tips and advice. And remember, knowledge is power when it comes to your health.